Okay, good day nurses. Today, let us discuss the chest tube or your chest tube thoracostomy, the closed system. Okay? Noon guys, if nakakita na kayo ng ganitong chest tube or battle system, pwede pa. Okay, ganito yung ginagamit nila dati. Okay, meron din siyang tatlong battle. We have the battle number 1, battle number 2, and battle number 3. It is, the battle number 1, it is connected in the wall suction. Okay, siya yung nagre-regulate ng pressure regulating battle. Then, on the middle, okay, itong nasa gitna na battle na to, battle number 2 is a water seal battle. And this one naman, the drainage collection battle or the fluid collection battle is, this one is connected to the patient. Ito ay tinatawag nating battle system. But ngayon guys, meron nang tayong ganito, chamber system. Okay, ganito na yung itsura niya. Ganon din siya guys, parang tatlong battle din siya. Merong suction control chamber, we have the water seal chamber, and the collection chamber. Parang na, battle number 1, battle number 2, and battle number 3 na rin siya. Okay, now let us discuss this one. Okay, this one pala guys is tawag dito, board sensitive. Favorite din yan itanong, itong chest tube, your CCT. Okay? Usually, tinatanong to during PNLE and of course, NCLEX. If you are to have your NCLEX, then pwede nyong i-review to. Okay? Because this is high yield topics. Okay? Okay? Then, let us discuss what is chest tube. But before that, let's have a brief anatomy of our lungs, okay? Diba? On our lungs, we have what? Okay, this is our lungs, diba? Okay, the portion that it attached to our lungs is called the visceral pleura, diba? And the one that is not attached to our lungs, it's called parietal pleura. And then, yung space na between our visceral and parietal pleura, ang tawag dyan is intrapleural space. And that intrapleural space, it contains pleural fluid. Okay, para ma-avoid natin yung friction, mag-grab against each other para hindi siya masakit. That's why hindi masakit kapag when we inhale and exhale. Kasi merong pleural fluid that serve as a lubrication para hindi masakit yung paghinga at pag-exhale natin. And in our intrapleural space, nandyan ang negative pressure. It contains negative pressure. Ma'am, para saan po si negative pressure? That negative pressure, okay, is needed for our lungs to inflate. Para mag-expand siya, para mag-inflate yung ating lungs. Okay, so ang nagpapa-inflate ng ating lungs is due to the negative pressure. Okay? Now, what is chest tube? It is a tube inserted in the pleural space of the lungs. Doon siya ini-insert like this. One, okay? It helps, the CCT helps to remove air or fluid that has caused the lungs to collapse. Bakit ma'am nag-collapse yung lungs? Dahil nawala ang negative pressure. And what keeps our lungs inflated? Diba? It is due to the negative pressure. So magko-collapse ang lungs natin once, okay, natanggal ang negative pressure. Mamaya malalaman natin ano yung mga cases, bakit nawala ang negative pressure sa ating lungs, okay? And it also plays after cardiac surgery to help drain blood and fluid from around the heart, okay? Now, why would our client need chest tube? Bakit nila kailangan ng chest tube? Okay? There is something in the pleural space that we need to get it out or we need to remove it. Ano yung mga pwedeng nandoon sa pleural space natin? It could be air, it could be fluid, it could be blood. Kapag air yan, anong tawag natin? That's your pneumothorax. If it contains fluid, ano yan? Pleural effusion. Then if it contains blood, then it is hemothorax. Okay? We need to remove that. Okay? To allow our lungs to expand fully and to restore the negative pressure. That's the indication bakit kailangan mag-CCT ang pasyente. Okay, for us to remember it, let us, tawag dito, use this mnemonic pitch. Okay, P for pneumothorax, E for pleural effusion, A for abscess, C for cancer, specifically lung cancer, and H for hemothorax. Okay, it is indicated to re-establish the negative pressure of the lungs. And kapag re-establish na ang ating negative pressure, that's the time na mag-e-expand na ang ating lungs, our lung re-expansion. Okay, now, let's, tawag dito, discuss it further. Okay, number 1, pneumothorax. Okay, due to what? We have two types of pneumothorax. We have the open pneumothorax and closed pneumothorax. Okay, kapag open pneumothorax, guys, ibig sabihin merong penetrating injury na penetrate talaga yung lungs mo. Either sinaksak ka ng kaaway mo, that's an example of penetrating injury. Then, when we talk about closed pneumothorax naman, due to a ruptured bleb. Okay, bakit? Bakit may ruptured bleb? Or, pwede namang due to blunt trauma. Okay, na may blunt trauma ka na nag-lead into fractured rib. Kapag madaming rib ang fractured, ang tawag dun is frail chest. Okay, that is an example of closed pneumothorax. Bakit? Ma'am, yung ruptured bleb, yan yung kapag yung pasyente is may prolonged inhalation. Kailan ba nagpo-prolonged inhalation yung pasyente? Kapag nag-i-smoke, di ba? Sobrang hit-hit niya, okay? So, pwedeng mag-ruptured yung rib dyan or due to blunt trauma, okay? Anong mangyari sa patient? Pwedeng ma-fractured ang kanyang rib or multiple ribs, that what you call frail chest, okay? Then, another indication, pleural effusion, okay? Merong accumulation ng fluid in your pleural space due to infection. It's either bacterial, viral, or fungal infection. And also, indicated ang CCT kapag meron kang abscess or empyema or what you called pus. Okay, then lung cancer due to lobectomy. So, indicated ka to have CCT to drain the secretions post-surgery. Then lastly, we have hemothorax. Okay, to drain the excess blood in the thoracic cavity. So, ma'am, paano to? Kapag pneumothorax, guys, since air ang tinatanggal natin dyan, sa lungs natin, saan ba mag-accumulate yung air? Nasa taas ng ating, on the top of our lungs. So, i-insert yung tube at the second or third intercostal space. But for our pleural effusion, abscess, cancer, hemothorax, these are fluids. So, kung fluids yan, ibig sabihin nasa base ba siya ng ating lungs, nasa baba? Yes. So, yung tube is, i-insert yung tube at the 8 to 9 intercostal space. Okay? And to confirm, the gold standard for confirmatory standard ng placement ng ating CCT is through the use of X-ray. Okay, for confirmatory placement of our CCT is X-ray. Okay, now let's discuss this one, the drainage system chamber. Okay, we have here the bottle number 1, bottle number 2, and the bottle number 3. Okay, para mas madali niyong maintindihan. Our bottle number 1 is called suction controlled chamber. Now, our bottle number 2 is called water seal chamber. And our bottle number 3 is called drainage collection chamber. Okay, guys, ito yung kailangan nyong tandaan by heart. Kung anong mga characteristic ng each bottle. Para hindi kayo malito kapag nag-a-assess kayo ng patient ng may CCT or when you are taking your examination. Okay, for your bottle number 1, for your suction controlled chamber, anong characteristic na makikita natin dyan sa bottle na yan? There should be no tidling. Okay? When I say tidling, okay? Ibig sabihin lang, guys, it refers to the up and down movement of the water. Okay? Yan yung ibig sabihin ng tidling, up and down of water. So, dapat daw dito sa ating bottle number 1, walang tidling, walang up and down ng water na makikita dyan. Okay? Ang makikita lang natin dyan is gentle bubbling. Okay? And we monitor the level. We replace with sterile water as needed, yung suction control chamber. Now, our bottle number 2 naman is the water seal chamber. Anong karakteristik ang makikita natin dapat dyan? Okay, intermittent bubbling. Again, it should be intermittent bubbling. Bakit, ma'am? As the fluid levels move up and down, yan ang tidling. Kapag si patient nag-inhale and exhale, mag-up and down yan. Okay? Sasabay siya sa rhythm ng inhalation and exhalation ni patient. Okay? And for our bottle number 3, ang tawag natin dyan si drainage collection chamber. So, drainage collection. So, magka-collect ba siya ng drainage? Yes. Okay? Ang makikita naman natin dapat dito is no tidling. Okay? And ang characteristic dapat na makita natin na drainage dito, it should be serosanguinous or pink drainage. And this one, sa bottle nito, ito ang connected sa patient. The bottle number 1 naman, this one is connected to suction. Okay? Then, basahin natin lang ulit, tidling refers to the up and down movement of water in the water seal chamber. So, sa bottle number 2, the water level rises during inspiration and falls during expiration. Absence of tidling indicates that there is an obstruction in the chest tube or that the lungs has fully re-expanded. Okay? Okay, let's talk it one by one, each bottle. Okay? Now, we have here the bottle number 1, which is the suction control chamber. This one, guys. Okay? So, anong ginagawa nito? Okay? This suction airs. Okay? Sinusuction niya yung excess air. And then we have type of suction control chamber. We have the wet suction and the dry suction. When we say dry suction, ibig sabihin guys, it is attached to a wall suction. Ibig sabihin guys, hindi siya gumagamit ng water. Okay? Naka-attach siya sa suction wall para makapag-suck siya, okay? Then, unlike the wet suction, it uses water, okay? Now, the level of water is proportional to the level of suction. So, sa madaling sabi guys, kung increase ang water level, ibig sabihin guys, since it is proportional, okay, directly proportional, ibig sabihin mataas din or malakas din ang kanyang pag-suction. And if the water level is low or mababa, ibig sabihin mababa lang din ang kakayahan niyang mag-suction because the level of the water is proportional to the level of suction sa wet suction. Now, ano ang tatandaan natin dito sa battle number 1 or the suction control chamber? Okay, kailangan natin tandaan na normal dito ang continuous or constant bubbling. Okay, yan dapat ang characteristic na makita natin sa battle number 1. Sa suction control chamber, normal ang continuous or constant bubbling. Okay? Now, we move on to battle number 2, the water seal chamber. Okay. Dito naman, pine-prevent niya ang air na mag-backflow. Okay, yun yung use ni water seal chamber. And it contains 2 cm of water. Okay? Ang normal na characteristic naman na makikita natin sa battle number 2 is minimal bubbling or minimal tidalling. Or yung ginagamit ng karamihan ay intermittent bubbling. Okay, yan yung normal na makikita natin sa battle number 2, intermittent bubbling. Due to what? Due to the patient's breathing. Once na mag-inhale si patient, tataas yung water level. And kapag nag-exhale siya, bababa. That's what you call fluctuation. Okay, nag-fluctuate. Intermittent bubbling. Okay, then what if there's no continuous bubbling or tidalling sa water seal chamber? Ano ang nangyayari? Okay, kung wala tayong nakitang continuous bubbling or tidalling. Okay. What if there's pala? Okay. Allow me to correct myself. There's a continuous bubbling or tidalling in the water seal chamber. Anong ini-indicate niya? Ibig sabihin guys, merong air leak. Okay. That air leak can lead to tension pneumothorax. And one complication of your CTT or your chest tube thoracostomy is the development of tension pneumothorax, lalo na kapag may air leak. Paano mo malalaman na may air leak? Kapag nakita mo sa water seal chamber or kapag nakita mo sa battle number 2 na merong continuous bubbling. Ano lang dapat meron dyan? Intermittent or minimal bubbling. Okay? Now, kapag guys, merong continuous bubbling, it indicates air leak. Anong gagawin natin? We need to locate the leak on the tubings. Ilolocate natin, hahanapin natin, then we notify the healthcare provider. Okay? Ano pa? Ma'am, what if naman there is no bubbling or tidalling in the water seal chamber? Anong indication naman nun? Dalawa lang ang pwedeng maging indication yan. It's either merong obstruction or kinks or pwedeng yung lungs ni patient ay fully nag-re-expand na. So, ma'am, paano ko din madedetermine kung alin dyan sa dalawa ang nangyayari kay patient kapag nakita ko na sa water seal chamber or sa battle number 2, there is no bubbling or tidalling. Okay. Mamaya. Pag dalawa lang ang ibig sabihin niya, di ba? Kung merong obstruction or naging okay na si patient, yung lungs niya nag-fully re-expand. Okay. Pag may obstruction, guys, magkakaroon ng obstruction kapag may development ng clot. May namuong clot dun sa tubing. That's why we need to maintain the patency of the tubing. Kapag si patient naman, nag-fully re-expand na ang kanyang lungs, ibig sabihin na restore na ang negative pressure. Di ba? Ano kasi inflate sa lungs natin? It's the negative pressure. So ngayon, paano mo nga malalaman kung naging okay na ba si patient or may obstruction? It depends on the time of insertion. For example, guys, 2 hours, okay, 2 hours after ma-hook si patient sa CTT, nakita mo na ang water seal chamber ay walang bubbling or walang tidalling. Anong indication yan? Okay, may obstruction or naging okay na si patient. Okay, dahil 2 hours pa lang yan, ibig sabihin guys, hindi pa masyadong na-drain yung mga fluids or air kay patient. So, ang ibig sabihin lang yan guys, there is a obstruction or kinks. Okay? Okay, nagigets? What about ma'am kapag 4 days or 3 days after chest tube insertion? Okay. You notice that the water seal chamber or the bottle number 2 has no bubbling or tidalling. What's that indicates? Since 3 days na yan, ibig sabihin, naging okay na ba? Na-manage na ba? Na-drain na ba natin yung fluids or air or blood sa lungs ni patient? Pwede, kasi 3 days na siyang minamanage. Okay, ibig sabihin ng guys noon is na-restore na ang negative pressure sa lungs ni patient. Nag-fully re-expand na ang lungs ni patient like this one. Okay, fully re-expanded. Okay, so be careful. Tignan nyo yung time. When you are determining kung anong nangyayari sa water seal chamber. And lastly, sa battle number 3, the drainage collection chamber. Okay, we have nursing responsibilities dito sa drainage collection chamber, guys. Okay, number 1 we need to monitor the fluid output post-operatively every hour or Q1 hourly ang pag-monitor natin ng fluid output niya dyan for the first 24 hours. Okay, for the first 24 hours. Then we watch out for 100 ml or greater than 100 ml of fluids within 1 hour. We need to notify the healthcare provider kapag nakita natin na within 1 hour, 100 ml na ang na-collect doon sa drainage collection chamber. We need to notify the healthcare provider. Why? Because that indicate there is an active bleeding na nangyayari kay patient. Okay? Then the drainage must not touch the tip of the tube. Kung for example, this is the bottle, yung drainage, hindi niya dapat tapos nandito yung drainage, hindi niya ma-touch yung tip, or kapag nandyan na yung ganon, this is the bottle, ito yung ganon, yung tube, dapat hindi niya ma-touch. Okay? Bakit? It will backflow. Okay? It will backflow. Okay? Backflow of drainage to the patient. So, dapat hindi niya natatouch yung tip ng tube. Okay? Then, we change the drainage as ordered by the physician. Okay? Only time to clamp the tube. Kailan lang tayo magka-clamp ng tube? Kapag mag-change tayo ng system as ordered. Okay? Then, we clamp the tube near to the patient. Okay? Then, avoid prolonged clamping to prevent tension pneumothorax. Okay, pag-usapan natin mamaya si tension pneumothorax. Then, kailan tayo magka-clamp? Sabi ko nga, when we are changing the system as ordered and checking for air leaks due to constant or continuous bubbling in the bottle number 2 in the water seal chamber. That's the time lang na pwede kang mag-clamp. Okay? I hope you understand that, guys. Ano pa? We have Then we also have another nursing considerations, guys, okay? We always keep the drainage system below the levels of the client chest. So, nasa baba siya, okay? So, by the use of gravity, para mas mabilis natin mag-drain lahat ng fluids or blood or air, okay? Ensure the tubing is free of kinks and draining freely, okay? There should be no dependent loops in the tubing. Then we monitor the drainage. Anong i-monitor natin? The color, the odor, the consistency, and the amount. The color should be serous to sanguinous, okay? Why? No, the client has a CT. Okay? Know why the client has a CT. Anong indication? Then the color, it should be none. Walang amoy. The consistency, it should be thin to thick. And the amount, dapat no more than 70 to 100 ml per hour. Diba? Kapag madami yan, 100 ml, greater than 100 ml per hour, you notify the healthcare provider. Okay? Drainage stop in the first 24 hours, call the primary healthcare provider. Then we mark the amount marked hourly, okay, Q1, okay? Then we palpate the insertion site to check for crepitus. Kung saan naka-insert kay patient yung tube, ipalpate natin yung skin niya to check for crepitus. Ma'am, ano yung crepitus na yan? That crepitus is a crackling sound indicating that there is a presence of air in the subcutaneous tissue. So, parang crispy yan pag pinalpate yung skin niya, indicating na merong air dyan. That's what you call subcutaneous emphysema. Then, allow deep breathing, okay? Cough and Q2 repositioning changes every 2 hours to promote lung re-expansion. And upon removal of the CCT, we instruct the patient to bear down, okay? To prevent air entry to the insertion site. So, mag-bear down siya. Hold na yung breath niya as the doctor remove the CCT, okay? Another, guys, anong gagawin natin kapag there is chest tube disconnection? Na-disconnect ito. Okay, anong gagawin natin? We place the end of the chest tube in a bottle of sterile water. We need to submerge this one in a bottle of sterile water. So, kapag naka-CT si patient, dapat always ready lang sa bedside ang bottle of sterile water in case na ma-disconnect ito. Okay. Okay, na-disconnect ito. Okay? What if naman natanggal ito? Dito part, natanggal. Na-dislodge, okay, accidental dislodgement of tube from the patient. Anong gagawin natin? We cover the site with a sterile dressing like this one. Okay, we tape on 3 sides only. Okay, this one, 1, 2, 3. Dito part naka-open, hindi natin ita-tape. Okay, so that air can escape this way. Dito mag-escape yung air. Kasi if you tape on 4 side, you might cause tension pneumothorax. Okay? Sa tatlong side lang tayo magte-tape. Okay? Never na 4 side. Pag 4, tinip mo yan, it will cause the patient to have a tension pneumothorax. Delikado yun, guys. Then we call the provider, then stay with the client. Okay? We cover it with occlusive dressing, tape on 3 side. Then after natin ma-tape, then we notify the healthcare provider. Okay? Okay, this one is a pneumothorax, guys. Ito yung complication ng CCT. Okay, anong nangyari dito? Characteristic, merong tracheal deviation. Okay, nagpaganon siya, nag-deviate siya. Pumunta siya dito sa unaffected side. Okay, tracheal deviation to the unaffected side. And kapag nakita natin na may tracheal deviation, then we notify the healthcare provider immediately because that indicates pneumothorax. Okay, delikado yan. Okay, di ba? Dito yung part na nag-collapse ang lung. Puno yan ng air. So, dahil puno yan ng air, malakas ang pressure, ipupush niya yung mga other organ from the unaffected side. Okay, that's what you call tension pneumothorax. Okay, that's why merong tracheal deviation. Okay, ganito yung itsura niya. Okay, then this is the summary, guys. Okay, these are the summary. Okay, babasahin ko Okay, so we monitoring the drainage. When monitoring the drainage system, ano yung monitor natin? The battle number 1, battle number 2, and battle number 3. Okay, the collection chamber. Okay, collection chamber. Ay, ito yung battle number 1 natin, binalitad lang. Basta ito yung, wag kayo malulito, the collection chamber, or from the word itself, it collects, okay? Collects air, blood, and fluid. Anong nursing assessment natin dyan? We monitor the amount, the color, and consistency of drainage. Then we report to the healthcare provider if there is greater than 100 ml per hour of bloody drainage, okay? Then for the water seal chamber, anong i-monitor natin dyan? Anong normal dyan? Intermittent bubbling, okay? Ang abnormal dyan, if there is a continuous bubbling, that's indicate air leak, okay? And for the suction control chamber, okay, we monitor for bubbling. It should be gentle bubbling, which is normal. And the absence of bubbling, meaning not enough suction. Okay, yan pa yung iba niyang indication. Okay? Now, for the chest tube complications and intervention. For clients with chest tube, we keep a sterile gauze and a bottle of sterile water at the bedside to quickly address complications. So, yan dapat ang mga available sa bedside ng patient. Okay. Complications such as yung tube is na-dislodge, natanggal yung tube from the patient. Anong gagawin natin? We cover the insertion site with sterile gauze dressing and tape on 3 side. Then we notify the healthcare provider. Kapag naman na-disconnect, natanggal yung tubing sa system, okay? Or drainage system breaks, anong gagawin natin? We immediately place the tube tip into a sterile water to create a temporary water seal. Then, if perong may air leak, anong indication? May continuous bubbling sa water seal chamber. We check for the connection, then reinforce the dressing, then we notify the healthcare provider. For the occlusion naman, no drainage. We check the tubing for kinks and gently strip or milk tubing only. Okay, remember that? Only if ordered. And that's all, guys, for your chest tube system, or chest tube thoracostomy. I hope you learned something. Thank you and God bless.